Alrighty, so today I decided that I'm going to record my anatomy flashcards so I can listen to them later. And we're going to be starting with the gluteal region. So let's get this on the road. First, we're going to start with the glute max. The proximal attachment of the glute max is the posterior ilium, the dorsal surface of the sacrum, coccyx, and sacrotuberous ligaments. The distal attachment is the IT band and the gluteal tuberosity. The innervation is the inferior gluteal nerve, L5-S2. The blood supply is the inferior gluteal artery and the superior gluteal artery. The action of the glute max is to extend the thigh and laterally rotate the thigh. Next is the glute med. The proximal attachment of the glute med is the external surface of the ilium, the anterior and posterior lines. The distal attachment is the lateral surface of the greater trochanter. The innervation is the superior gluteal nerve, L5-S1. The blood supply is the superior gluteal artery. The action of the glute med is to abduct, medially rotate the thigh, keep pelvis stable during ipsilateral rotation, and advance contralateral pelvis during swing. The next one is going to be the glute min. The proximal attachment for the glute min is the ilium. The dorsal attachment is going to be the anterior surface of the greater trochanter. The innervation is going to be the superior gluteal nerve, L5-S1. The blood supply will be the superior gluteal artery. The action of the glute min is to abduct, medially rotate thigh, keep pelvis level during ipsilateral limb, advance contralateral pelvis during swing. Next is the TFL, or tensor fascia lata. Latte? The proximal attachment is going to be the AOIS and the anterior iliac crest. The distal attachment is going to be the IT band and Gerdy's tubercle. The innervation is going to be the superior gluteal artery, L5-S1. The blood supply is going to be the superior gluteal artery and the ascending branch of the LCF. The action of the TFL is to ABD, abduct, medially rotate thigh, keep pelvis level, and assist with stabilization of the knee and hip. Now we go into deep glutes. We're going to do the piriformis. So the proximal attachment of the piriformis is the anterior surface of the sacrum and sacrotuberous ligaments. The distal attachment is the superior border of the greater trochanter. The innervation is going to be the nerve to piriformis, S1, S2. The blood supply will be the inferior gluteal artery. The action is to laterally rotate thigh and steady the femoral head in the acetabulum. Next is the obturator internus. The proximal attachment is the pelvic surface of the obturator membrane. The distal attachment is the medial surface of the greater trochanter. The innervation is going to be the nerve to obturator internus and superior gemellus, L5-S1. The blood supply will be the superior gluteal artery. The action is laterally rotate the thigh and steady the femoral head in the acetabulum. Next will be our superior gemellus. The proximal attachment is going to be your ischial spine. The distal attachment will be your medial fossa of the greater trochanter. Your innervation will be nerve to obturator internus and superior gemellus, L5-S1. Your blood supply will be inferior gluteal artery. The action is to laterally rotate the thigh, abduct, flex thigh, and steady the femoral head in the acetabulum. Then we have inferior gemelles. The proximal attachment for the inferior gemelles is the ischial tuberosity. The distal attachment is the medial fossa of the greater trochanter. The innervation will be the nerve to the quadratus femoris and inferior gemelles, L5-S1. The blood supply will be the inferior gluteal artery. And the action will be to laterally rotate the thigh, abduct the flexed thigh, and steady the femoral head in the acetabulum. The last one for the gluteal region is going to be the quadratus femoris. The proximal attachment is the lateral border of the ischial tube. The distal attachment is the quadratic tubercle on the intertrochanteric crest. The innervation is going to be the nerve to quadratus femoris and inferior gemelles, L5-S1. The blood supply is going to be the medial femoral circumflex artery. The action will be to laterally rotate the thigh and steady femoral head onto acetabulum. And that is going to be it for the gluteal region.